trolley. Basic the surgical instruments first. So I'll just quickly take you through my surgical trolley. Zoom out and just show me around. Can you take out the camera? So, we need, starting from one side, we need to have a 15 number and 11 number blade, the mosquitoes, the scissor, the pot. Okay.
Yeah, focus it. Yeah, now it's good.
Sure. So you'll have to move. So pot scissor is something we use for arteriotomy. And then these one which actually call them rubber shots. So you actually cut the infant feeding tube and you pull it over the mosquito. You use it to hold the proline, which otherwise breaks off if you hold them with just normal mosquito scissors. The cat's paw are very good for the superficial retraction, and the other end of Langenbeck helps for the little deeper retraction. The right angle forceps, there is the endarterectomy spatula we normally use for endarterectomy. The blunt end sometimes helps to probe into the vein, so it acts as an initial vein dilator, and the spatulated end sometimes helps to take out if there is some thrombotic material. And if you have a surprise in vein that despite looking at Doppler you find some of the thrombotic material inside, you can actually do a bit of thrombectomy and then create fistula. For the final work at the time of anastomosis, I personally prefer this ring tip forceps. You can see it's got small ring on the tip. It's very precise to hold the fine sutures and vein. This what I'm holding in my hands is a workhorse for any vascular surgeon. So you see the tip, it is called DeBakey forceps. It's got vertical serrations, and it's a non-crushing. So yeah, you can actually see it very well here. And then Cassavo needle holder, it comes with lock, without lock. I personally prefer with lock. It's very good to rotate around the 60 and 70 proline. And then some suture cutting, and plus a self-retaining retractor. It helps a lot, especially when either you are operating alone or you have one operator, and the bulldogs of different sizes. Plus these are the DeBakey angle clamp, although they might look big, but I use them for the break. When we'll use it. The heparin saline, we make it typically around in bowl of salines roughly around 500 ml, 4 to 500 ml. We put around 1000 ml of 1000 units of heparin. Infant feeding tube is a good guide we use it for multiple purposes. We'll see when we go across. Then there's some other things which we're not going to use. So now, can you come at the operative site?